Because everybody got quiet. Well, my job is to welcome all of you here today, and so I certainly want to wish you a good day and coming to what will be and is UnityPoint St. Luke's these days, and UnityPoint St. Luke's Foundation. And while we have a new name since the last time we've gathered, we really are very much the same group of people trying to take care of lots of other people every day. Though if you came to the forums, you do know that part of the reason for this name change for us is that we are trying to signal to ourselves and to the public that we want to deliver health care in a new and better way. And I really do believe that. The good news is, if you came to the forums, we also played a video. And at the end of the forums, the video basically shows you all the people you work with each day and the people you care for each day. And it basically reminds you of all the things that are going through their lives and how each one of us have to remember that the colleague next to us may not be having the best day, that the patient that we're dealing with, that may be the same kind of patient we've dealt with every day for the last 3 weeks, it's still a unique experience in their life for them and their families. And that we have that same job of making sure that we bring the kind of compassion, the kind of clinical knowledge to the table that we always have. But we are being challenged these days to do it in a different way. Because if you are on the other side of that bed, or of that clinic visit, or that screen, it is a very intimidating experience no matter how good each of us are at our jobs. And one of the things we as an industry, and I would even argue as an organization, that we've not done as well as we could, is put the pieces together for those patients and those families in a better, more cohesive fashion, as opposed to just doing our part of the job as well as we could. Because we've done that well, and we've done that with compassion, and we've done that with expertise. But we haven't always had the best handoffs. We haven't always made sure that that patient and that family had all the confidence in the world that the next 3 to 5 things that they needed to happen were already set up, as opposed to things that they needed to worry about what comes next. And that's the opportunity for all of us, and for this generation of those of us in healthcare. And so as you come to Nurses Week, we're here certainly to celebrate those among you who have done extraordinary things. Maybe you've done them for years and you're just being recognized this year, or maybe you did something truly out of the ordinary in the past year that you're being recognized, or maybe you're getting a scholarship that basically says we believe in you and what you're going to be able to do in the future. But the point is, it's a day when each of us get to recommit to making sure that we're going to live up to the goals and aspirations we had for getting into this business. And hopefully each of you will find this an opportunity for you to refocus on what you're in nursing for and why you're part of an organization like UnityPoint St. Luke's, because we are about to build a much better healthcare system for the people we take care of. And we are going to move away from just dealing with every patient in an individual episode of care to taking care of that person and their family over their entire lifetime. That's the goal, to do it differently and in a far better way. Well, I know we've got some individuals that we're going to celebrate today. I know we've got 2 ladies here, Julie Gilmore and Cheryl Mahoney. Are they with us? Who are our top 100 nurses for Iowa. Let's give them a round of applause real quick. All right. So we want to start the celebration here. We also have about 25 associates being honored with their Patient Care Excellence Awards. We've got some scholarships to hand out. But this afternoon we also want to make sure we're here to thank our donors who make these scholarships possible to honor our staff. We're very, very fortunate to have some wonderful supporters in our community, and the foundation really has been a great guardian of that and facilitator of that support over the years. So we appreciate them bringing us together today to make this happen. That culture of philanthropy is also an important part of what we want to do, and it's part of what we also want to celebrate, and so today is a great opportunity to recognize both of those things. So at the end of it, it's a pretty simple message. You folks continue to be the greatest resource of this organization. You are the greatest resources to the patients and the people we want to take care of in the future, and hopefully you will find our opportunities to celebrate that a good thing today. I need to personally and publicly make sure I thank some donors who are with us. I think we have Fred and Lois Schumann with us today. We've got Pam Mahaney. Here, right Oh, Pam, I'm sorry. Dr. Dale and Louise Morgan, did they make it with us today? Don't see them, but Nancy Skogsberg, I see you here. Nancy, I recognize you. You look the same as when I got here 11 years ago. All right. Elaine Young's with us. All right, certainly recognize Elaine. Lynn Dennis, don't know if she made it with us today. And Dr. Ghosh may be joining us a little later. I don't see him yet. And Dr. Jim Lamorgis and his wife Nancy, who last I knew were still in Arizona or New Mexico or somewhere. But in any case, those are some of the folks who make these awards possible, and so we want to make sure. Let's give all of our donors a round of applause as well. And so with that, again, I welcome you to UnityPoint St. Luke's, and I would ask Mary Ann to take over. Mary Ann, all right.
Hello, and let me please extend my welcome as well to all of you to our Patient Care Excellence Awards ceremony, and also to wish all the nurses among us a happy Nurses Week. It's great to see so many of our families here with us, and also our donors, to help us celebrate and to truly recognize these great individuals. I always say that great nurses are often surrounded by great families, the individuals who sort of keep the home fire going while they stay late or come early or work that extra shift. So as you hear their stories today and understand the impact that they're having on people's lives, I hope you feel a great deal of pride and know that we appreciate your role in helping us deliver that mission that we care so greatly about. So we really appreciate your part. And then also just a personal congratulations to all of our winners. It is truly an honor and a pleasure to be with you this afternoon and to celebrate your commitment and excellence that you do every day for St. Luke's, our patients, and our families. On behalf of the hospital, I want to thank our donors. Ted mentioned several of you as well, but I want to just say that without your generosity, this awards ceremony, the awards themselves, and the scholarships would not be possible, and it really helps us recognize our associates who are going above and beyond and gives us an opportunity to help support them in continuing their education and their growth. So we can't thank you enough for your generosity. Our award winners include nurses, therapists, patient care techs, social workers, managers, and directors. So many disciplines and many levels within our organization. The one thing that each of our award winners have in common, however, regardless of their role or their discipline, is that their number one priority is our patient and their families. Each strive to provide an exceptional patient-family experience with compassionate and respectful care. They live and breathe St. Luke's mission, which is to give the health care we'd like our loved ones to receive. They are role models for our standards of excellence, and many of the associates in the room know what those are, but for those of you that are our guests, let me just acknowledge a couple of those. Commitment to coworker, privacy, confidentiality, safety awareness, communication, compassion. These are the things that we live by. It describes how we do our work here at St. Luke's, and these folks model it every day. Our mission statement is close to the heart of all of our winners. When asked to reflect on when they provided the health care that they went above and beyond to meet our mission, these are some of the things that our award winners said to us in their application. One person said, "Each day I ask for strength and guidance that my passion for St. Luke's mission will be sincerely present in my actions and words." Another, "It is difficult to sit down and think of a specific example. I am a nurse. It is my responsibility to care for the sick. But I feel to truly give the best care to our patients, we need to be invested in them. Not only invested in their health, but connected to them as individuals." The next person wrote, "Though I have an innate drive to always be learning, it is the ability to bring compassion and comfort to my patients that defines who I am and why I do what I do. The greatest rewards of being a nurse are the relationships formed with the patients and families, which often extend far beyond their length of stay. My patient's success is her own. My role is just giving her the opportunity to show her what she is capable of achieving and not assuming she won't." Another person said, "I recognize how difficult it can be on very busy days to take the extra time for a patient's special need, but this simple act can make the difference between a positive hospital stay and a very scary hospital experience." And finally, I do not consider what I do going above and beyond. What I do for every patient is what I would do for my family. So I don't know how you say it any better than these individuals have, and it just exemplifies the caliber of the individuals in this room and in our organization. Our award winners are respected by their coworkers, physicians, and the patients they care for. They have impressive resumes, such as designing new innovative programs, leading committees, and volunteering. And just to give you a sample of some of what these people are doing in our organization, one person is a member of a new program in a physician's office to help the chronically ill patients navigate the health system. Another started the first Patient Family Advisory Council. Someone developed and implemented the policies for our intraoperative radiation therapy when we began that service. Yet another started the TIES program, which is teaching interventions to empower and strengthen families. And many in this room were what we call EPIC super users. They got us through the EPIC storm last summer when we put our new EHR in place. Thank goodness for every one of them. And then many serve as preceptors for our nursing students. And it just goes on and on from there. But beyond the work they do at St. Luke's and within our organization, they are also, many of them, involved in the community as volunteers. And here's some examples of organizations in which they volunteer. Cub Scout leaders, Girl Scouts, Big Brothers, Big Sisters, the Community Free Health Clinic, Juvenile Diabetes, Habitat for Humanity, Young Patients Network, and Special Olympics. Again, just to name a few. These individuals have a pattern of caring for patients, the peers they work with, and their communities. And I recently read in the paper, Nancy Brown, one of our faculty at Mount Mercy University, was quoted recently as saying that her job is to teach students to think critically, act compassionately, and work collegially. I loved that. I thought this was a wonderful summary of the type of clinicians we want to hire and retain in our organization. Our nominees and recipients certainly demonstrate these qualities in the way they consistently approach their work. So it is truly a joy to work and to celebrate with you. So with that, let's begin our celebration. So I have the privilege of presenting to you formally the St. Luke's nurses who were recognized last Sunday in Des Moines for Top 100 Great Iowa Nurse. So I will tell you a little bit about the award, but I will ask Julie Gilmore to start walking up front as one of our first recipients, and I will tell you about the award and about Julie. 2013 is the 9th year for this Iowa tradition. The University of Iowa College of Nursing, the Iowa Nurse Association, and the Iowa Hospital Association have partnered to launch a celebration of Iowa's 100 great nurses. The nurses were nominated and chosen based on their demonstrated concern for humanity, significant contributions to the nursing profession, and leadership through mentoring. So now let me tell you about Julie. Julie is a nurse in our intensive care unit. She's been with us for 23 years. And in Julie's nomination papers, one of the comments was, Julie's most significant contribution to our nursing profession would be her unwavering, patient-centered approach while innovating new ideas. Julie is also active in the promotion of the nursing profession by exemplifying the behaviors of a lifelong learner, including obtaining her BSN after her diploma in nursing, obtaining certification in critical care nursing, and many years of membership in various professional organizations, including the American Association of Critical Care Nurses. Please help me in congratulating Julie Gilmore. And next I would like to invite Cheryl Mahoney to please come forward. Cheryl is an advanced practice nurse within our medical surgical department of the hospital. She's been with our organization for 3 years, but she actually joined us from UnityPoint out of Des Moines. She was with our sister organization in Des Moines. Cheryl is always looking at the whole patient experience and tries to find ways to enhance their stay in the hospital. She has presented multiple times to our associate groups on comfort care. She teaches and mentors others on physical and emotional comfort measures. It can be in small ways, such as product selection for razors and toothbrushes, to teaching clinicians how to establish a trusting relationship with the patient and the family. This spring, Cheryl will be introducing a new program for direct care clinicians to understand how to enhance their empathy and their communication skills. She believes, and we all do as well, that learning how to communicate is a skill that can be taught, just like learning how to put an IV in, but it takes development, and Cheryl is very committed to that. Her sincerity and role modeling makes her a great teacher, so please help me in congratulating Cheryl. And now I'd like to just talk a little bit about logistics for the rest of our time here together. I'm going to turn the program over to Mary Klinger. Mary Klinger is the Vice President of Development in our foundation, and she's going to assist in the presentation of the Patient Care Excellence Award and scholarship winners, as well as recognize our donors as we go. Each award will be presented by the previous award winner from previous years or the recipient's manager. Mary will facilitate the transition between the presenters and will briefly describe the award being presented as she calls both the presenter and the recipients forward. So at this time, I'd like to introduce Mary Klinger.
Great, thank you so much. It is my pleasure to be here on behalf of the Foundation to be able to honor and recognize the following associates receiving awards. And as Mary Ann had mentioned, as I call your name and the presenter's name, come on forward as I continue to talk about the award, and then the presenter will talk about the recipient a little bit. The first Patient Care Excellent Award is the Darrell Dennis Pulmonary Medicine Award. The 2013 winner of this award goes to Rhonda Kenny from Respiratory Care Department. Her award will be presented by Dean Bleedorn, also from the Respiratory Care Department. This award, created in 2007, is presented annually to one individual who contributes to the care of critically ill patients. The recipient demonstrates a strong commitment to continued learning, values corporate citizenship, and contributes to the hospital goals through the outstanding leadership skills. This person stands above his or her peers in internalizing the St. Luke's standards of excellence in daily practices. Dr. Darrell Dennis was a pulmonologist who provided unparalleled dedication to his patients and unwavering respect and appreciation for the healthcare professionals who worked by his side. Dean?
I've known Rhonda for 18 years, quite a long time. She's done extensive evidence-based research to update department procedures on airway care, oxygen therapy, artificial airway care. She's developing competencies for our trach care team. When asked about her patients, Rhonda replies, "I have learned many lessons from my patients and their families in the years I've worked at St. Luke's. Sometimes it's the small things that make the biggest difference to these people." So please join me in congratulating Rhonda.
Excellence in Behavioral Health Award. The 2013 Excellent in Behavioral Health Award winners are Danny Darbyshire from 3 East, Erica Greshner from 2 East, Rosemary Jacobson from Outpatient Behavioral Health, Jessica Komisar from Behavioral Health Support, Kasha Lakowska from Mental Health Professional, and Carissa Vidal from 1 West. These awards will be presented by the 2012 winners, Rachel Breck from 1 West and Sandra Bills from 2 East. The Excellent in Behavioral Health Award is presented annually to staff nurses who demonstrate excellence in behavioral health. These individuals, chosen by their peers, are involved in special projects or programs within their unit or division, demonstrate clinical expertise, seek further nursing education, and are team players. This award was established in 1984 by Dr. W.J. Morshall out of his generosity and desire to educate psychiatric nurses. Rachel and Sandra.
first of all, Danny Darbenshire. Danny is an excellent behavioral health nurse. She is cross-trained as a SANE nurse and a behavioral health access nurse. Pierce comments were, Danny does a great job with the patients, showing them respect and is well-liked in return. She communicates well with patients and is a professional and courteous. You can always go to Danny if you have questions or just need another opinion. And I know I've dealt with Danny in the access as a charge nurse on 2 East. She's always courteous and respectful and great to deal with. Congratulations. Erica Grazier. Erica was chosen by her peers for this award because she delivers care we want our loved ones to receive. She has strong leadership skills, which she utilizes well in charge of the unit. She assists others with whatever is needed to have a successful shift for her peers and a successful hospitalization for the patients. She is a strong behavioral health nurse advocating for our patients every shift she works. And I know I speak for everyone on 2 East when I say that she exemplifies professionalism. Her smile and attitude is infectious, and we just adore her. Congratulations, Erica. Rosemary Jacobson. Rosemary has extraordinary talent. She is a professor at Mount Mercy University, as well as a behavioral health nurse at St. Luke's. Her peers describe her as excellent, a natural teacher for both clients and staff. She is always willing to jump in and help wherever she can. Her expertise in leading groups is invaluable. Congratulations, Rosemary.
Jessica Comazar is the unit secretary on 3 East. She's only been here for a little over a year, but she has already made a big impression on her peers. She's always willing to help in whatever is needed, doesn't wait to be asked. She's starting her education to become a nurse and will be an excellent nurse due to her professional and compassionate style. Her peers comment, she's kind and respectful to our patients and their families. She's always courteous to staff, never afraid to ask her for help or ask a question. She's an absolute delight. Congratulations. Kasha is a recreational therapist on 2 East. She's been here for 12 years. She works with our behavioral health adult patient population. Recreation therapy offers diversional activities for our patients. Part of her job is providing crafts and activities that challenge and allow expression to take place. She always treats people compassionately without judgment. She coordinates our unit's Thanksgiving and Christmas events for patients when they are unable to be with their families. Congratulations. Carissa Vidal is a vital part of our One West team. She's a great leader and is able to think and act quickly in difficult situations. She's an active member of our unit fall committee and the peer review committee. She just completed her bachelor's degree and has plans to continue on to become a nurse practitioner. Her peers compliment her positive attitude, compassionate nature, and willingness to help. Congratulations.
Award is the Anna Perna Ghosh Oncology Nursing Award. And the 2013 recipient of this award is Jeremy Haig from Infusion Center. His award will be presented by the 2012 winner, Stephanie Asmussen. Thank you. From 5 Center. The Ghosh Oncology Nursing Award is intended to recognize excellent oncology nurses who exemplify the following characteristics. They place an emphasis on human caring and compassion, demonstrate excellent clinical assessment skills, facilitate smooth transitions between levels of care and providers, and lead with good corporate citizenship. The Dr. Ghosh established this award in 2010 in memory of his mother, Anna Perna Ghosh, who embodied the values of selfless giving.
All right, Jeremy has worked at St. Luke's for 13 years. He describes one patient and family experience. I visited him and his family nearly every day. I did not do it because I felt I needed to. I did it because I care about him and wanted to see how he was doing. I get to know my patients and families. I know what they are doing for fun holidays and vacations. I think they appreciate a familiar face, someone they know. After the patient transferred to a local care center, Jeremy continued to visit him. You deserve it. Congratulations.
The next award is the Lamorgis Award for Excellence in Neurological Nursing. The 2013 Lamorgis Award for Excellence in Neurological Nursing winner is Michelle Meyer from Cardiac Care Unit. Her award will be presented by Joni Copper. The Lamorgis Award for Excellence in Neurological Nursing is presented annually to a St. Luke's registered nurse who contributes significantly to the care and treatment of neuroscience patients. This nurse must demonstrate an affection of sound principles based on scientific method and medical research. This award was established in 2002 by Dr. Jim and Nancy Lamorgis. Dr. Lamorgis was Cedar Rapids' first neurosurgeon and served as St. Luke's Chief Medical Officer. Joni. Oh, thank you.
I'm going to step in as Michelle's nurse manager. Michelle transitioned from behavioral health to critical care in 2009, and she has impeccable attention to detail, and evidence-based guided care is present always in her practice. She feels that each day she asks for strength and guidance in her work. Her passion for the St. Luke's mission is sincerely present in her actions and words. Her most rewarding experiences tend to arise from situations when she is not only attending to the physical needs of patients, but the emotional needs as well. She's an amazing nurse.
The Ronald L. Mahaney Award. And Pam Mahaney, Ron's wife and widow, is here with us today. So Pam, if you could please join us. The winners of the Ronald L. Mahaney Award are Lisa Dolphin from the Whitworth Children's Therapy, Sharon Hill from Whitworth Children's Therapy, and Amanda Krogman from Inpatient Rehabilitation. These awards will be presented by Joe Lynn, Director of St. Luke's Physical Medicine and Rehab. The Ron Mahaney Award recognizes those who work within St. Luke's Physical Medicine and Rehab Division and who have contributed significantly to the care and treatment of patients needing rehabilitation. Nominees exemplify St. Luke's standards of excellence. Before he passed away, Ron Mahaney created a memorial fund in appreciation of all of the care and encouragement he received from his team at St. Luke's Physical Rehab. Ron wrote specific to the endowment established in his name that it is always good to make a difference for organizations that really help people on a day-to-day basis. Joe?
Thank you, Mary. First of all, what I would really like to share as a part of the presentation today is really how much the Ronald L. Mahaney Award has meant to the staff within the Physical Medicine and Rehab Division. This actually is centered around an award presentation that we really hold every year around the Thanksgiving holiday. And it's just really kind of a neat thing that we've developed with the Mahaney family. And very much want to extend my appreciation to Pam for being here today. And actually through this award, we have just actually got to know the Mahaney family very well, and that just continues to grow year after year. So again, something very special and a very special honor to be a recipient of the Mahaney Award. First, I'd like to recognize Lisa Dolphin. Lisa, first person here to my left. She is an occupational therapist with Whitworth Children's Therapy. She's been with St. Luke's for 15 years. Lisa sees the potential in all her patients. She sees beyond their limitations and gently motivates them to achieve their highest potential, no matter what their disabling condition is. She was a key initiator of a multidisciplinary team who works with children and families who have significant eating difficulties. She serves as a mentor for new and established staff and goes above and beyond to schedule critical patients into an already full schedule. Lisa, too, is just one of those individuals. She is one of our senior therapists on our staff. As I had mentioned, she's very much looked up to as a mentor, and just, again, provides great care to our patients every day. So please help me in congratulating Lisa. Next recipient is Sharon Hill, to my left here. There's a lot I could say about each of these individuals. Sharon was actually manager of a Whitworth Children's Therapy service for quite a period of time, and she decided to retire this past year, so it's great that she's here with us today. Sharon's entire career has centered on improving the lives of infants and children in our community. She was a pillar in creating Whitworth Children's Therapy with incredible vision to provide developmentally appropriate care for premature infants. Sharon has directly and indirectly touched the lives of thousands of infants and children from our NICU and pediatric departments. And as I mentioned, Sharon also functioned as the manager of Whitworth Children's Therapy, recently retiring last fall. Sharon was actually with St. Luke's Hospital for 22 years. So please help me in congratulating Sharon. It's your turn, Amanda. Okay. Amanda Krogman. Amanda is our nurse supervisor on 6 West. She's been with St. Luke's Hospital for 11 years. She has held several roles. She was a super user for our electronic medical record implementation, assisting both staff and physicians. Amanda is also the supervisor of 6 West Rehab, as I had mentioned. Her staff say she is an excellent resource who is able to answer any questions that come up. She has an excellent rapport with staff and the healthcare team. She is dedicated to giving the highest level of care to all patients and families. Amanda provides education that is sensitive to the needs of rehabilitation patients and their families. And I have to just, again, thank Amanda for everything she does for us every day. Great resource on 6 West. Thanks, Amanda.
Okay, our next award is the Dale and Ruby Morgan and Mabel Ray Award for Pediatric Nursing. The 2013 Dale and Ruby Morgan and Mabel Ray Award winner is Jessica Thomas from Behavioral Health Services. Her award will be presented by 2012 winner Robin Colbert from NICU. The Dale and Ruby Morgan and Mabel Ray Award is presented annually to a registered nurse who contributes significantly to the pediatric or psychiatric nursing care of children. The recipient places an emphasis on science, human caring, compassion, and good corporate citizenship. The nurse demonstrates the ability to comfort and console patients in their time of need.
Her manager says Jessica is sought out by many staff for her skills with Epic and her ability to find solutions to problems.
She was instrumental in developing a process to complete patient submissions in the emergency department. This has been a positive contribution to the goal of getting behavioral health patients to the unit and settled in a shorter amount of time. Congratulations.
Next is the Carol and Lena Nelson Critical Care Award. The 2012 recipients of this award are Jessica Sismadia of 3 Center, Colette Webster Moore of Cardiac Holding. The awards will be presented by the 2011 winners, Julie Gilmore from the Intensive Care Unit and Anja Olferts from 3 West. The Carol and Lena Nelson Critical Care Award is presented annually to 2 associates who contribute to the care and treatment of critical care patients. These nurses go above and beyond normal job performance, making significant contributions to the care of the critically ill patient, placing an emphasis on human caring and compassion. The recipients demonstrate compatibility and willingness to comfort and console patients, have a passion for continued learning, and good corporate citizenship. In 1981, the Carol and Lena Nelson Critical Care Scholarship Fund was established by Lena in memory of her late husband. Julie and Angela?
And Jessica, she is a nurse on 3 Center. She started as a student tech and remained there after graduation from Mount Mercy. Jessica was recently promoted to a supervisor position on 3 Center. Her manager describes an observation of Jessica in a critical situation. While orders were taken, meds given, and interventions set in motion, Jessica is quietly and intentionally using touch to ease her patient's fear and softly speaking to her, all the while explaining to the patient what was going on and what we were going to do quickly make her feel better. It is amazing to watch her knowledge and compassion to work simultaneously.
In 2005, Colette joined the St. Luke's and Cardiac Holding. She is currently the lead RN on this unit. She is an active member of our Shared Governance Practice Council and her own practice council. One of her recent projects is working with the cardiology offices to facilitate a smooth transition for the admissions of our pre-procedural outpatients. She is a very deserving person for this award.
The next award is the Nancy Lamb Skogsberg and Edna Lamb Nursing Clinical Leadership Award. And Nancy is here with us today, so if you could join us, Nancy. The 2013 Nancy Lamb Skogsberg and Edna Lamb Nursing Clinical Leadership Award is Peg Bradke, Director of Heart Care Services. Her award will be presented by the 2012 winner, Jenny Houlihan of Critical Care Unit. The philosophy behind this award is to recognize a leadership group or director level senior clinical leader who embodies the spirit of servant leadership. This leader, like Nancy, will exhibit undying commitment to St. Luke's mission, value, and vision. The award recognizes a leader who is an outstanding St. Luke's ambassador in the community. This leader's work is constantly focused on patients and their families. The award was established in 2007 by Nancy Skogsberg's brother, Jack Marchant. Mr. Marchant established this award honoring Nancy as well as his mother, Edna Lamb. Mrs. Lamb worked at St. Luke's from 1935 to 1955. Jenny?
For those of you that know Peg, you know that she's driven by one thing, and that is the patient and the patient experience. This has been evident throughout her entire career when designing the first cardiac rehab program. Peg always asks herself and others, what is it that the patient needs and wants? She then builds processes and plans around that. As a result, she formed the first patient advisory board at St. Luke's. She highly values her managers, leadership team, and the work they do. She is supporting and encouraging of their development as leaders, And Peg is able to lead through her vision and innovative ideas. Congratulations.
The next award is the Smulikoff Family Award for Nursing Excellence. The 2013 Smulikoff Family Award for Nursing Excellence Award winners are Jill Beltrame from Birth Care Center, Tammy Dietrich, Skin Care Services, Robin Colbert from NICU PICU, Wendy Young from Breast and Bone Health. Presenting these awards are the 2012 winners, Erin Boone from 3 West, Kylie Fink from 3 Center, and Bryce Richmond from 5 West. The Smulikoff Family Award for Nursing Excellence, established in 1980, is presented annually by the Smulikoff family to 4 St. Luke's nursing associates who exhibit excellence in nursing practice. These nurses have demonstrated exceptional leadership skills and the ability to communicate in a positive and therapeutic manner with patients, families, and other staff. They function as a patient advocate who show flexibility in meeting unit needs and often have achieved certification or advanced education in their specialty area. This award was first given to Mr. Smulikoff for his personal dedication to St. Luke's as a longtime board member for both the foundation and hospital. When he received this award, his family decided to honor him by establishing the Smulikoff Award for Nursing Excellence. Okay. Turn it over to you guys.
Jill has been a nurse in the Birth Care Center for 18 years. Jill, over the years, has been involved in Unit Practice Council, Evidence-Based Practice, Iowa Health System Council, and Frontline Leadership. She was an EPIC super user, charge nurse, and preceptor, among other mentoring roles. Jill bonds very well with the families for which she cares. She forms a relationship with their families, and they often seek her out before they go home to say goodbye and thank you.
Next is Tammy Dietrich. Tammy's worked at St. Luke's for 34 years. Throughout that time, she has been an oncology nurse, an ICU nurse, and currently works in the skin care services. She has been instrumental in teaching others, building policies, and developing procedures to reduce healthcare acquired pressure ulcers. She is a member of the National and State Wound Ostomy Registered Nurse Organization, and she frequently advocates for patients to ensure the best care is given. Congratulations, Tammy. Next is Robin Colbert. She is a nurse with her transport certification. She is able to transport critically ill babies by ground and air. Robin provides exemplary care to her patients. She is also a diabetic educator and on the asthma education team. Robin is the chair for the developmental care team. The goal of this committee is to provide the best care as well as to improve neurological outcomes for premature babies. She and the Evidence-Based Practice Committee are working on several new initiatives in the NICU. Congratulations, Robin.
The next recipient I'm announcing is Wendy Young. She currently is in the Breast Cancer Care Coordinator, Breast and Bone Health. She's been with St. Luke's for 25 years. When asked about the care she provides, Wendy says, "My goal is to provide education and support to ensure that each patient is empowered to make the best possible decisions about their care. Although I am part-time, I will always stay with the patient or call them with biopsy reports because I know what it's like to be waiting for that phone call." In her job, she provides continuum of care from the diagnosis of breast cancer to the treatment to survivorship. She guides patients through the challenges that span the issues of communication, treatment, and recovery. Congratulations.
Next is the Social Worker Award. The 2013 Social Worker Award winner is Jennifer Owens from Medical Social Services. The award will be presented by the 2012 winner, Nancy Hagensick from the Helen G. Nassif Community Cancer Center of Iowa. This award is presented to a St. Luke's social worker who demonstrates excellence in the practice of social work. This recipient models the St. Luke's standards of excellence and exhibits leadership skills within the department, hospital, and community. The award is funded through the Violet Criswell Endowment. Violet was a native of Benton County and trained as a nurse at Rush Presbyterian in Chicago, Illinois.
One of Jennifer's coworkers says, Jennifer has shown leadership through her commitment to evidence-based practice. In that she has. She spent the last 2 years doing a research project, effects of an enhanced psychosocial assessment on readmissions of patients with COPD, and has in fact presented this at the University of Iowa National Evidence-Based Practice Conference this last year. She has also, within the department and for the social workers throughout the hospital, initiated and is leading a journal club for social workers to join in reading and discussing research articles with relevance to best practices. She has most recently taken a position as an outpatient social worker, and as part of that job serves on the advanced medical team here at St. Luke's, the first to be formed. And it's a program that strives to improve the health of our most complex patients. And Jennifer's attention to detail is just the fit for that program. She focuses on the needs of patients regardless of where they're at, in the outpatient setting or in the inpatient setting. She is passionate about her efforts and about her coworkers and working as a team. Congratulations, Jennifer.
Next is the Dr. Stephen and Peg Van Orney Award for Excellence in OBGYN Nursing. The award recipient for this year is Amy Foreman from Birth Care Center. Her award will be presented by the 2012 winner, Deb Longauger from the Birth Care Center. The Van Orney Award, established in 1987, is presented annually to a St. Luke's nurse who contributes significantly to the care and treatment of OBGYN patients. The recipient demonstrates affection for sound principles based on scientific method and medical research. They demonstrate human caring and compassion and also display good corporate citizenship. Dr. Van Orney was a founding physician for OBGYN and Associates. He also served as St. Luke's Hospital President and CEO from 1996 to 2002 and was instrumental in the creation of the Nassif Heart Center and Nassif Center for Women's and Children's Health.
I am very excited to be here for the presentation of the Van Orney Award to our own Amy Foreman from the Birth Care Center. Amy's been at the Birth Care Center for the last 10 years. She is a member of our professional organization, A1. Amy's an outstanding preceptor for our new hires. Her peers, including myself, say she's an absolutely great charge nurse. She's very creative and flexible with her staffing needs, and she's constantly promoting better productivity on the unit. Amy's also able to facilitate positive bonding experiences with her families and their new babies despite unanticipated events that happen during childbirth. Congratulations, Amy.
Next is the Elaine Young Leadership Award, and Elaine is today, so if you could join us. The 2013 Elaine Young Leadership Award winner is Carol Mead from Children's Specialty Services. Her award will be presented by the 2012 winner, Denise Abel from Five Center. The Elaine Young Leadership Award, established in 2005, is presented to a person in a leadership role. The recipient is an outstanding mentor in the development of their staff to pursue high-quality care and has demonstrated a significant contribution to quality patient outcomes. This leader will also demonstrate a willingness to work effectively with others to promote the strategic goals of St. Luke's Hospital. Ms. Young was instrumental in starting and advancing critical care nursing at St. Luke's. She exemplifies the spirit of St. Luke's and is passionate about preparing strong clinical nurses who also possess the same qualities. Denise.
Carol has been here for 10 years, currently the manager of Children's Specialty Services. Carol says, I can't tell you how many times I reflect back on St. Luke's mission over the course of a week or even a day. When working with children and families, I often think, what would I want if they were my children? It is the driving force in everything I do, and I can use it to answer the hard questions. Carol was unanimously nominated for this award by her peers. Please congratulate Carol.
The next is the Care Service Award. The 2013 award winner is Heather Laronimo from Force Center. Her award will be presented by Joni Copper. This award is presented annually to an individual who consistently provides support and assistance to patients, families, and any member of the healthcare team. The recipient should demonstrate on a daily basis behaviors consistent with the St. Luke's Care Delivery Model. And CARE stands for C, continuity of care, communication, and collaboration. A, advocacy, accountability. R, relationship-based. And E, evidence-based.
Her manager says, I receive the most accolades from patients on the great care that Heather provides. I can honestly say that I am either told or received a written letter from patients at least twice a week, as a reflection of the great care she consistently provides. She is calm and reassuring to patients and their families. Her approach is special and compassionate, and she is a role model in the care that she provides. Congratulations.
The next award is the Outstanding New Graduate Award. The 2013 award winner is Ashley Dodge from 3 Center. Joni Copper will also be presenting this award. This award is presented to a graduate of an RN or LPN program within the last year. The recipient demonstrates a genuine interest for patient need, works well with others, and offers assistance where needed. This nurse shows a commitment to continued learning and demonstrates competence and leadership. A quote from Ashley's nomination said, Ashley was a super user for Epic 2 months after receiving her RN. She was a tremendous resource for our department. Ashley was also instrumental in the implementation of care rounding. She is a great leader and role model. She readily accepts change and frequent mentors others by percepting students. Ashley is clearly above where we would expect a new graduate to be so early in her career. Next, we'll move on to celebrate and recognize our 2013 scholarship winners. The first scholarship is to recognize is the Natalie and Joe Cohn Scholarship. The winner of this scholarship is Robin Bardell from Case Management. This scholarship assists associates pursuing a nursing degree. Joe and Natalie Cohn were philanthropists supporting numerous charities, including Mercy Medical Center, St. Luke's Foundation, Tanager Place, and Camp Courageous. Robin has been with St. Luke's for 14 years and is manager of case management. She is currently enrolled at Mount Mercy University to receive her master's in nursing administration and is expected to graduate in December of this year. Robin's supervisor, Carmen Conrade, stated this in her reference letter. Robin is very committed to the success of St. Luke's Hospital and is aligned with the organization's strategic goals and standards of excellence. She believes in quality work and quality outcomes. She continues to work towards positive results, works well with her team, and strives to improve on her personal areas of growth. I am impressed with Robin's work, her desire to further her education in order to grow and expand her knowledge base. She will truly bring all she learns to her workplace so that we can all benefit. Congratulations, Robin. The next scholarship is the Nursing Scholarship. The 2013 Nursing Scholarship winners are Sherry Bosch from the Cardiac Cath Lab and Amy Trout from 3 Center. If Sherry and Amy could come forward. Sherry is an RN in the Cardiac Cath Lab and has been with St. Luke's for 13 years. She is currently enrolled at Allen College to receive her Master's of Science in Nursing, Nurse Educator. She is expected to graduate in May of 2014. Sherry's ultimate goal is to become a critical care educator here at St. Luke's. Sherry's supervisor, Dave Phillips, stated this in her reference letter. Sherry is a credit to the nursing profession. She shows strong leadership in her field. Her decision-making and critical thinking skills are excellent. She has worked on several projects, either within our department or throughout the hospital, and her communication is outstanding. Congratulations, Sherry. Amy is a manager on 3 Center and has been with St. Luke's for 21 years. She is currently enrolled at Mount Mercy University to receive her Master's of Science in Nursing, Nursing Administration. She is expected to graduate in May of 2014. Amy never imagined after 20 years of nursing that there was so much still to learn. She has developed a thirst for learning that she thought she would never experience again. Amy has realized that the scope of nursing spills into the community in ways she could never comprehend. Studying the Patient Protection and Affordable Act has given her insight as to the challenges ahead. Amy stated, "Furthering my education will put me in the best position possible to rise to the leadership challenges that await." Congratulations, Amy. Next is the Greta Schuchman Scholarship, and Fred and Lois Schuchman are here, so if you could join us. The 2013 Greta Schuchman Scholarship winner is Whitney Frost with Marketing and Communications. This scholarship is for non-traditional students. The Greta Schuchman Scholarship was established in 1983 by Mr. Fred Schuchman in honor of his late wife, Greta, who was an active St. Luke's volunteer. Today, Fred and Lois Schuchman continue to be good friends of St. Luke's Foundation, supporting a variety of programs from Lifeguard, Hospice, Child Protection Center, and the Greta Schuchman Scholarship. Whitney works in the marketing department and has been with St. Luke's for 6 years. She is currently enrolled at Mount Mercy University to receive her Master's in Business Administration. She is expected to graduate in May of 2015. Whitney feels she has the best job in the hospital as she gets to be involved with all of the aspects of employee relations, including recognition, training, communications, celebrations, culture building, and the patient-family experience team. She states, "Working with employees is rewarding because I feel I am helping not only the employees themselves, but ultimately our patients. By working to foster an excellent culture for our employees, we also create an outstanding experience for patients, families, and visitors of St. Luke's." Congratulations, Whitney. Finally is the Keach Scholarship. The 2013 Keach Scholarship winners are Kimberly Enstedt from 3 East, Kylie Fink from 3 Center, Barb Hayter from Cardiac Outcomes, Terry Kelleher from Visiting Nurses Association, and Jessica Thomas from Behavioral Health Services. The Keach Scholarship assists individuals pursuing health-related degrees or special education. Established in 1969, this scholarship extends support to nursing students whose fields will enable them to continue to impact the world around them. Dr. and Mrs. Keach's mission through this funding is to make available to worthy young people the advantage of an education in nursing for their benefit, in order that they will be able to be in a better position not only to help themselves but to extend their influence to others. The first is Kimberly. Kimberly served as a patient care tech and summer RN intern in 2012 and has been with St. Luke's almost a year now. She is currently enrolled at the University of Iowa School of Nursing to receive her BSN and is expected to graduate in December of 2013. Kimberly's ultimate goal is to become a pediatric nurse practitioner and nurse educator. Congratulations, Kimberly. Next is Kylie. Kylie is an RN on 3 Center and has been with St. Luke's for 6 years now. She is currently enrolled at Allen College to receive her Master's of Science in Nursing, Acute Care Nurse Practitioner. She is expected to graduate in May of 2015. Kylie's ultimate goal is to practice as a nurse practitioner in a hospital setting. Dr. Dustin Arnold stated this in her reference letter. Kylie is resourceful and intelligent. She is dedicated to compassionate patient care. She consistently demonstrates a diligent work ethic and clinical knowledge base beyond her station of career and training. Kylie truly brings out the best in all who know her and have the privilege to work with her. Congratulations. Next is Barb. Barb is a cardiac outcomes coordinator and has worked at St. Luke's for 27 years. She is currently enrolled at Mount Mercy University to receive her Master's of Science in Nursing and is expected to graduate in December. Barb's true passion is to mentor and teach new nursing staff. Dr. Sharon Guthrie stated this in her reference letter. Barb displays enthusiasm and eagerness to learn by coming into and maintaining throughout a class a positive attitude, and she is very supportive of her peers. She demonstrates her critical thinking and organizational skills and leadership skills throughout each course with all assignments and actions. Barb clearly demonstrates potential and commitment to be a leader and an outstanding nurse in her future career. Congratulations, Barb. Jessica is an RN in Behavioral Health Services and employed at St. Luke's for 4 years. She is currently enrolled at Allen College to receive her Master's of Science in Nursing, Family Psychiatric Mental Health Nurse Practitioner. She is expected to graduate in August of 2016. With her ARNP degree, Jessica wants to help with the shortage of mental health providers to offer more access to mental health services. Dr. Eric Johnson stated this in her reference letter. I believe Jessica to be an outstanding nurse and significant asset to St. Luke's. She is able to function at a consistently high level and is able to see the big picture in ways that other nurses may not. She will undoubtedly be a good nurse. Congratulations. And now moving forward, this concludes the Patient Care Excellence and Scholarship portion of the program. The leadership and dedication that is exhibited here is truly outstanding. And congratulations to you all once again. Let's give everyone another round of applause. Not done. Now I'd like to introduce Shirley Holtide, Scholarship Chair for St. Luke's Auxiliary and Vice Chair for St. Luke's Foundation. Shirley will present the Auxiliary Awards and make closing comments.
On behalf of St. Luke's Auxiliary, Nancy Mortimer, our current president, and the 2013 Scholarship Committee, I am pleased to announce the winners of our Nursing Auxiliary Scholarships. The first recipient is Kylie Fink. Kylie has worked on the telemetry unit here at St. Luke's for over 5 years. During her tenure at St. Luke's, she has received numerous nursing awards. She is currently pursuing her master's degree from Allen College and hopes to become a nurse practitioner in a hospital setting. Congratulations, Kylie. Thank you. Our second recipient is Katie Rubakava. Katie works full-time on 3 West. She was named Rookie of the Year on her floor for her first year. She's currently pursuing her BSN at the University of Iowa and would eventually like to become a family nurse practitioner. Congratulations. I would also like to thank our scholarship committee members, Gail G. Buck and Joanne Bryan, for their fine efforts in selecting these very deserving young ladies. We had an outstanding group of applications, as I know the hospital did, and it's always difficult to choose who you think is going to be absolutely the best recipient, but we think we've done a great job. I'm now going to put on my hat, which is my foundation board role that I play here at St. Luke's. As the St. Luke's Foundation's Vice Chair, thank you very much for attending today. St. Luke's Foundation received more than 120 applications for Patient Care Excellence Awards and scholarships. In 2013, the Foundation created the Patient Care Excellence Selection Committee and a Scholarship Selection Committee to review all of the applications, the essays, and all of the references. This is a time-consuming and really, really challenging process. It's no easy task, and each member took their role seriously to determine who were the winners. I would like to thank the following staff who served on the Patient Care Excellence Selection Committee: Rachel Brecht, 1 West, Joni Copper, Nursing Services, Kylie Fink, 3 Center, Whitney Frost, Marketing, Nancy Hagensick, G. Nassau Community Cancer Center of Iowa, Sandy McIntosh, Emergency Department, Ann Overton, Women's and Children's, Jana Peterson, Surgical Services, Sarah Reinschmidt from the St. Luke's Foundation, and Tanya Arnold, also from the Foundation. I would also like to thank the Scholarship Selection Committee: Dorlyn Benson, who's now retired, Carol Collingsworth from the lab, Sarah Heffelfinger, I really worked on that one, Social Services, Nescaman, James Fedor, PMR, Nancy Chauvin, Foundation, Tanya Arnold from the Foundation. Also, we would be remiss if we didn't thank the Planning Committee for first week. They do an awful lot of work, and sometimes we forget to acknowledge them. Rachel Brecht is from 1 West, Joni Cobb from Nursing Service, Whitney Frost from Marketing, Nancy Jennings from Police and Kincaid, Nursing Support, Moffitt from the Foundation, Paula Pizarnik from MCN Operations, Tina Rice, Nursing Support, Vicki Richards, Staff Development, and Ellie Stephan from St. Louis Care Company. We'd also like to especially thank Tanya Arnold, Vicki Richards, and Joni Copper for their outstanding leadership of this whole process, because it is a very, very busy time for them and a lot of extra work, but they've done a wonderful job again this year. St. Luke's Foundation could not provide the awards and scholarships without our generosity of our donors, who have or had a passion and commitment to furthering healthcare providers' education. For over 30 years, our donors have created funds at the Foundation. Today, these funds are still giving back by providing financial resources for St. Luke's associates to continue their education. Today, St. Luke's Foundation provided almost $10,000 for award winners to continue their education, and another $30,500 in scholarship funds. We are forever grateful for our donors. Thank you very much. Finally, and very importantly, we want to thank the award and scholarship winners. are the reason St. Luke's has such wonderful care. We have compassion and we're innovative. That is so wonderful. You are very much appreciated.